Welcome. Today we'll be covering chapter 5 on antibiotics. So we'll start with a kind of overview of just different key concepts related to antibiotics, including their classifications and significance in our setting. Time permitted, we will work on our Kahoot. Granted, that's if we have time. And then we are going to wrap up everything and look at different things with chapter 5. And let's get started. Before we dive in, we have to think about how antibiotics work. So let's take a look.
How do antibiotics work? Pathogenic bacteria in the body cause infections, which can be treated by antibiotics. Antibiotics can be bacteriostatic or bactericidal. Bacteriostatic antibiotics slow the growth of bacteria by interfering with the processes the bacteria need to multiply. These processes include DNA replication, metabolism, e.g. enzyme activity, protein production, bactericidal antibiotics kill the bacteria, for example by preventing the bacteria from making a cell wall. Penicillins are bactericidal. Penicillins include penicillin 5 for sore throats, amoxicillin for chest infections, and fluxloxacillin for skin infections. Antibiotics can be so-called broad spectrum, affecting many different bacteria in your body, including useful bacteria in your gut. Some antibiotics are more narrow spectrum, only affecting one or two types of bacteria. It is better to use narrow spectrum antibiotics where possible. Most antibiotics have no effect on your immune system. Antibiotics do not work on viruses because viruses have a different structure to bacteria. Viruses incorporate themselves into a host cell in your body in order to multiply. Bacteriostatic antibiotics that affect bacterial DNA, metabolism, or protein production do not attack body cells and therefore do not slow the growth of viruses. Viruses do not have a cell wall, and therefore bactericidal antibiotics that act on cell walls cannot kill viruses.
All right. So quick overview of antibiotics. We have to define terms as per usual. We got to look at abbreviations for antibiotics and antimicrobial therapy. We're going to look at categories of antimicrobial agents. We're going to break down HAIs, which are healthcare associated infections, and surgical site infections. We have to really look at the purpose of antibiotic therapy in surgery and identify how antimicrobials even work. We still got to talk about some that are resistance. Antibiotic resistance occurs when bacteria develop the ability to kind of resist the effects of antibiotics. And then we have to finish up looking at common categories of antibiotics that we use in surgery. Now, we look at the applied surgical pharmacology. We're going to learn about all the important medications that we use, meaning that we're going to have to understand it because there's going to be times when they're going to be given to you on the surgical field. Some ways to kind of memorize it. The chapter tells you to kind of like make some cards with different details about each drug to kind of help familiarize yourself with how these drugs affect the body. Now, in surgery, medication plays a huge role, and then knowing them will prepare you for what you're going to do as a surgical tech. It's all about just having that knowledge, okay? Now, in surgery, the term antimicrobial refers to any agent that fights harmful microorganisms. This includes antibacterials, which kill bacteria, antiprotozoals, which target protozoa, antifungals, which treat fungal infections, and antiparasitics, which kill parasites. There are drugs like sulfa and mercury that were historically used as micro or antimicrobials, but they are not as common today because of the side effects of using those. Now, in the surgical field, the main type of antimicrobial used is antibiotics. You may see that again, so I'm going to repeat it. In the surgical field, the main type of antimicrobial used is antibiotics. And that's because they help prevent and treat infections that could occur in or around the surgical site. For example, giving antibiotics before surgery can help protect patients from harmful bacteria that might enter their body during a procedure. This is going to reduce the risk of surgical site infections. That's SSIs, surgical site infections. And it's going to ensure that, hopefully, knock on wood, there is a safer recovery for the patient. Now, SSIs are a major public health concern. According to the Centers for Disease Control and Prevention, CDC, SSIs account for about 30% of all healthcare associated infections in hospitalized patients in the United States. An SSI is defined as an infection occurring at or near surgical incision within 30 days after a procedure. You may want to know that. SSI is defined as an infection occurring at or near a surgical incision within 30 days after a procedure, meaning that it is so important for us to understand and help prevent these infections. One of the most common bacteria responsible for SSI is Staphylococcus aureus, which is naturally present in the nose and on the skin out of about 25% of healthy people. Now, because it's already there, strict sterilization and aseptic techniques are going to be important to prevent these bacteria from kind of getting into the surgical wound. So if you do have time, look at table 5.1 in your book because it lists the different pathogens that are linked to SSIs, which most infections caused by 6 of the bacterial species. Okay, so take a look when you have an opportunity. Now, antibiotics are powerful. They're natural chemicals produced by certain microbes to inhibit or kind of slow down or even kill other microbes. As STs, we have to understand the role of antibiotics because they are the most effective tool used alongside sterile techniques to prevent and treat infections in the operating room. Now, antibiotics are also known as antibacterials. These are a type of antimicrobial agent that target and again slow down bacterial pathogens. They help the immune system fight infections by either stopping it altogether or killing it. So we break it down preoperatively. We're eliminating bacteria before making an incision. So we are prepping the patient's skin. Intraoperatively, ongoing protection during the procedure. Sometimes we will irrigate a wound, okay, with irrigation that has some type of antibiotic in it. Postoperatively, now we're trying to reduce the risk of infection during surgery. So anything that happened, we're also going to back us up and then protect the patient again, which means that we have to follow precise guidelines in making sure that we're choosing the right antibiotic. And before you guys freak out, it's not us choosing it. It's going to be the surgeon. They're going to be the ones kind of saying, hey, this is what we're going to use. And it's already going to be on the preference card. It's already going to be set for the patient. Okay. But it's still good to know. Now, Figure 5.3 illustrates the infection cycle, emphasizing that an infection occurs when you have a source of a pathogenic microbe, a transmission route, and a host that is susceptible. When we talk about SSIs, the infection is often initiated by the introduction of a pathogenic microorganism into that patient that's already susceptible. And remember, once we cut the skin and get inside of a body, that patient is already going to be immune compromised because they're not intact. The source of these microbes can be endogenous, meaning that the microbes that come from the patient's own body, like skin flora or bacteria that is in the gut. Okay, so anytime you're doing a belly case, you're going to know that at some point the case becomes contaminated. But don't worry, we're going to show you what to do and how to keep the patient safe. Or exogenous. These are external sources, including, let's say, environmental contaminations, like if our instruments are not clean, right? Or microorganisms introduced um, through the surgical team. So another thing I want you to think of, okay? Picture it. You are the surgical tech assigned to trauma, and you get a patient coming in, and they are a motor vehicle accident, okay? They have let's say a femur fracture, okay? And it's an emergency because we do not want the femoral artery to be cut. So we're going to go in and try to fix that. Now, while they were on their motorcycle, they luckily had a helmet on, but somehow their leg hit a tree, and I'm just kind of going way out there, and a tree branch went through their leg, and that's how their femoral or femur was injured, fractured. So they're presented into the operating room with this tree branch hanging out of their leg, right? Now, I also want you to think about what could have possibly been on that tree branch. And this is going to kind of bring all the exogenous microbes together. Okay. So maybe there was some ants or some caterpillars or something on the tree branch. And of course, there's leaves, there's bark. Um, and then it went through the patient's leg. So now whatever was on their jeans, let's say they were wearing jeans, is now gone through their body, right? So now you think about all of the potential microbes that could most likely cause some type of infection. Does that break down endogenous and exogenous for you? Yes, no? Okay. Now, this is important because the transmission route is how the pathogens move from the source to the susceptible host. Often, kind of facilitating breaches in sterile technique is another way during surgery. Now, breaking down a susceptible host, because I've been saying it for a couple sentences. This is just somebody whose immune system may be compromised, making them just that more vulnerable to infection. Factors like age, underlying health conditions, and the nature of the surgical procedure can increase susceptibility. We get an gram stain, rapid identification tests that are going to be important tools to assist physicians in prescribing an initial course of antibiotic therapy. One of the most common methods for distinguishing between the different types of bacteria is gram staining, which, when combined with bacterial morphology, is going to give us important information. So we get different categories. Bacilli, these are going to be like your rod shaped, right? You have your cockeyes. These are going to be spherical shaped bacteria, and then your spirals. Okay. Granted, this is figure 5.4. So this just kind of helps to identify the bacteria present in an actual infection. Now, with the gram staining process, you have crystal violet is going to be applied first, and then you're going to stain all the bacteria and it's going to look purple. For the gram negative bacteria, then you lose this purple stain during the washing process, while gram positive bacteria retain it. And I know this was in micro, but you see how it's all coming back together. Now, the distinction between gram-negative and gram-positive bacteria is going to be important because it impacts how infections are treated. Gram-negative bacteria tend to be way more resistant to certain antibiotics, while gram-positive bacteria is going to respond better to others. So when we use gram staining, we're trying to figure out the types of bacteria. The doctor can make informed decisions when prescribing an initial course of an antibiotic therapy. And for us, understanding whether infection is caused by gram negative or gram positive allows just for a more effective treatment and improve the patient's outcome. But we have to be able to identify the staining properties of bacteria, particularly their gram staining characteristics, are going to be important identifying the microbes and guiding our treatment, right? Now, again, gram negative, these bacteria do not retain the crystal violet stain and appear pink or red after the gram staining process. Okay. So we're looking at gram negative. Our gram positive, these bacteria retain, you look, the crystal violet stain and appear purple. So if you look, seems purple. When we combine staining properties with morphology, it allows for a general identification of many common types of bacteria. This identification is going to be important in just our clinical setting as it helps our doctors, our healthcare providers, us determine the appropriate course of therapy for infections. So when we're in the operating room and we're getting ready to do a culture and sensitivity. These items that you see on the slide from figure 5.5 are going to be items that are going to be passed to you from your circulator. Now, the process of growing microbes in culture is a fundamental step in determining the infecting pathogen and assessing their susceptibility to various antibiotics. So we get our microbial cultures, okay? The chapter talks about two, inoculation and incubation. With inoculation, this is a sample suspected of containing pathogens, such as a swab from an infection site. So what happens? Your circulator is going to open up the package. You're going to grab the swab from this area only. You don't want to touch any of this. You're going to grab the swab from here, hand it to your surgeon. Your surgeon is going to swab the area and either they're going to hand it back to you or they're going to hand it straight to the circulator. And what the circulator does is have the package open where they can slip the swab right into the tube and then send it off to pathology. The other way that they will do it is completely open up the entire package where you again would just take the swab. You would have this on your mail stand sterile. Once the surgeon hands it back to you, then you would place it in the tube. They also have it where you would hand this section to the surgeon, and what they would do is use a suction and suction up any of the items in the body and be able to send that off as well. Okay. Now, with incubation, the inoculated plates are incubated for 24 to 48 hours. That way they can look back and just have the bacteria grow. The incubation period is crucial because now we want to see what's going on with these colonies, and then we can further do more analysis. So when they're growing these colonies on these different plates, the lab techs play a huge role in really helping the pathologists identify these different pathogens. Now, we also look at antimicrobial sensitivity testing. The culture bacteria can be exposed to various antimicrobial agents, really to assess their effectiveness. This test helps to determine which antibiotics will be most effective against the specific pathogen. For an antimicrobial agent to be effective, it must have selective toxicity. That only means that it should target pathogenic microorganisms without harming the host's own cells. The principle is super important because you want to minimize side effects and ensure patient safety during the treatment. We get into prokaryotes and eukaryotes. Prokaryotes are just that one-celled organism, primarily represented by bacteria. They lack, if you notice, a nucleus. There's no nucleus there, and other membrane-bound organelles. Their genetic material is contained in a singular circular chromosome located in the cytoplasm. Okay. The ribosomes, they want you to know, that are smaller than 70S than those in a eukaryote, which influence how certain antibiotics are going to be able to bind and slow down bacterial protein synthesis. For eukaryotes, you'll notice that there are multicellular organisms, including plants, us, animals, fungi, and protozoa. They have a very defined nucleus and membrane-bound organelles, allowing for more complex cellular process. The size difference is going to be important in the design of antibiotics that specifically target bacterial cells without harming human cells. Okay. Now, the distinction between prokaryotic and eukaryotic cells is extremely important when we talk about trying to figure out the action of different antibiotics. Many antibiotics are designed to specifically target prokaryotic ribosomes, where now they can slow down bacterial growth while sparing human cells. Now let's get into the antibacterial actions. We work with spectrums of activity when it comes to different types of antibiotics. A microbial agent can act against pathogenic microorganisms through 5 different mechanisms. We look at the inhibition of cell wall synthesis. Now, some antibiotics interfere with the formation of the bacterial cell wall, leading to cell lysis. Certain agents target ribosomes, preventing bacteria from synthesizing essential proteins. Now, these antibiotics, they're going to come in, they're going to cause a ruckus and disrupt the DNA or the RNA synthesis. And what they're doing is they're just halting or kind of slowing down that bacteria from replicating. Some agents block specific metabolic pathways that are important for bacterial growth, and antibiotics may compromise the integrity of the bacterial cell wall, leading to cell death. And so that's why it's so important for us to know, hey, which one are we working with so that we don't have cell death, okay? Now, we look at broad spectrum antibiotics. Broad spectrum antibiotics are effective against a wide range of bacteria, including both gram-positive and gram-negative organisms. Example, ampicillin, tetracycline, okay? These are often used with specific causative agents of an infection, like when we know it's there, okay? But we also have narrow spectrum antibiotics. These target specific types of bacteria, either gram-positive or gram-negative, but not both. So, broad spectrum, both gram-positive and gram-negative; narrow spectrum, either or. So examples would be penicillin. This is going to be primarily effective against gram-positive bacteria. Vancomycin, targeting gram-positive bacteria. Now, these antibiotics are used when the specific pathogen has been identified, so we know what it is, and is known to be sensitive to the drug, minimizing the impact on our just normal flora and reducing the risk of it not working and becoming resistant. But there's also limited spectrum antibiotics. These have an even narrower range of activity, targeting a specific subgroup of bacteria. So Bactrim or bacitracin, this is one that we use almost every case in orthopedics, where we will use staples and then we'll use bacitracin. I want you to think of it as fancy Neosporin. Once you see it, you'll be like, oh, that's what she's talking about. It's effective against certain gram-positive bacteria and some antifungal agents. These are used in targeted therapy, especially in cases where a specific organism is confirmed and requires that just precise treatment. Now, I mentioned that we want to ensure that there is no resistance, but in healthcare, there is a challenge because of the concerning healthcare associated infection or HAIs. Approximately 70% of bacteria that can cause hospital acquired infections, just meaning that the patient got it in the hospital, are resistant to at least one of the agents used to treat these infections. Microorganisms can produce enzymes that chemically modify or destroy the antibiotic, rendering it ineffective. Okay. For example, B lactamase. These enzymes can inactivate penicillin and related antibiotics, which is really bad because we use penicillin. That's like our go to unless the patient is allergic. Now, some bacteria can modify their cell membranes to reduce or prevent the entry of antibiotics. This alteration comes in and it's like a barrier, it's like a protection that is going to be there from the effects of the drug. Bacteria can actually change the structure of the targeted site where the antibiotic is supposed to bind, making it again ineffective. Okay, for example, look at a mutation in, let's say, a ribosome RNA. This can prevent antibiotics from interfering with the protein synthesis. But microorganisms may develop to enhance efflux pumps, which are protein structures that actively transport the antibiotics out of the cell before it can exert its effect. Again, effectively lowering the drug concentration inside the bacterium. We also talk about superbugs. These are strains of bacteria that have been developed resistant to multiple antibiotics, making infection that much harder to treat. The emergence of superbugs is linked to the misuse and overuse of antimicrobial agents, leading to the rapid development of, you know what, we're going to be resistant to different pathogens. And what that does is it impacts on normal flora. Now, normal enteric bacteria in a person's gut, like in your stomach, can also become resistant to antibiotics through indirect exposure, such as consumption of antibiotics through contaminated food or inadequate hand hygiene. This resistance can have severe implications, leading to complications in treatment if these bacteria cause infection. Now, this is important for us because we play a key role in infection prevention and management. We need to be aware of these type of infections that are common in our setting. The importance of appropriate antibiotic selection and kind of strategize just to minimize resistance development to adhering to sterile technique to reduce the risk of infection, ensuring that the proper antibiotics, and we'll do this as a team, you're not by yourself, is administered at the right time during surgical procedures, and then just making sure that we're all educating our patients and each other about the importance of responsible antibiotic use so that we can combat the rise of resistant organisms. Okay, now we're going to break down different antibiotic classes. Antibiotics are going to be important because they manage infections, especially in our setting. So, beta-lactams, all right? Penicillins were the first, I will repeat this. Penicillins were the first antibiotic discovered and remain widely used for various bacterial infections. What they do is they come in and they slow down bacterial cell wall synthesis, leading to cell lysis, and then it's going to die. Examples, penicillin G, amoxicillin, and oxacillin. So the ones that we see the most, penicillin and amoxicillin. We have cephalosporins. This group is derived from cephalosporin C, and it's similar to penicillin, making them effective against a broad range of bacteria. So remember, broad range, both gram-negative and gram-positive. But these also inhibit cell wall synthesis, which makes them effective against various gram-positive and gram-negative organisms. So we have cephaloxin, citrofloxacin, and cefpime. You will see ciprofloxacin often in the operating room. And then you have your carbapenemines. These are considered the last resort. I repeat, the last resort due to their broad spectrum and effectiveness against resistant bacteria. They are highly effective at inhibiting bacterial cell wall synthesis. So we have meropenem is an example of that one. But again, it's a last resort. Now, despite their effectiveness, it's still important to note that most agents in the beta-lactam class are not effective against methicillin-resistant Staphylococcus aureus, also known as MRSA. Why? Well, MRSA is a significant concern in the surgical setting due to its resistance to commonly used antibiotics, necessitating the use of alternative treatments. Again, the first true antibiotic being penicillin. Penicillin was discovered by Alexander Fleming in 1928. It was the first true antibiotic and marked a turning point in medicine, revolutionizing the treatment of bacterial infections. Now, penicillin are classified into several categories based on their spectrum of activity and their structure. We have natural penicillins, penicillin G, penicillin 5, and penicillin G benzathine. We also look at broad spectrum penicillins. We have piperacillin. This is effective against a broader range of gram-negative. This is similar to piperacillin, used similar for its activity against Pseudomonas and other resistant gram-negative bacteria. We do have advantages of natural penicillins, being that they are lower cost, generally inexpensive, making them accessible to widespread use. These antibiotics make a good, safe profile with fewer side effects compared to many other antibiotics. So for us, understanding the types of penicillins is going to be important when we're assisting in the selection of prophylactic antibiotics during surgeries to prevent infections. We're going to be those ones that are like, oh, making sure the patient doesn't have an allergy, right? Because we do not want to have an allergic reaction in the operating room. We look at cephalosporins. Now, these are a class of antibiotics that are structurally and functionally similar to penicillin. They are commonly used in our settings just to prevent and treat infections because, again, they are a broad spectrum. We have our first generation, Ancef, Kefzol. We use Ancef a lot, primarily effective against many gram-positive bacteria and some negative organisms as well, often used for surgical prophylaxis due to their ability to fight against skin flora. We have our second generation, Melphoxin, Cefoten. These are, again, broad, but they are used for treating intra-abdominal infections and gynecological infections. Okay, so abdomen, gynecological, second generation. We also have our third generation, Rocephin, Cefobid, used in treating healthcare associated infections and for patients with more complicated infections. Okay. Now, there are, again, 5 generations of cephalosporins, and each with a distinct characteristic. So I encourage you to look at table 5.4 because it kind of breaks down each generation and their specific uses. Going into our 4th generation. Now, the 4th generation have a broader spectrum. They are effective for treating serious infections, including HAIs, and they can penetrate the central nervous system, making them suitable for treating meningitis. And our 5th, Telphora, they are valuable in treating complicated skin and soft tissue infections and are commonly acquired or community-acquired pneumonia. Again, going back to that table, you kind of break it down, but I did want you guys to kind of see what they look like. And this is before they're reconstituted with saline, but this is what they look like. if you see them in your operating room. Now, the last line of defense against multi-drug resistance bacteria are our carbapenems. Now, they are often referred to as that last line of defense, especially in the face of rising antibiotic resistance. Promyxin is the one that you see on the slide, was the first introduced in the setting and the standard for this particular class. It works by inhibiting cell wall synthesis in bacteria, leading again to cell lysis and death. They're effective against a wide range of gram-positive and gram-negative bacteria, including some that are resistant to other antibiotics. It offers coverage against many gram-negative, though other ones in this particular category may not be effective against like pneumonia. All right. Now, these are often reserved for those severe infections in our patients, particularly when other antibiotics fail or when dealing with suspected or confirmed MDR infections. Due to the increasing prevalence of these antibiotic resistance, it is so important to understand when utilizing these particular drugs. It's we as surgical tech and healthcare providers understand how they work and what they're going to be used for. Now we get into monobactams. And the one we're going to talk about specifically is azithromycin. It is a monobactam antibiotic that stands out as the only drug in its class. And so I found this really cool video that I was like, let's check it out. Now, it is specifically designed to target infections caused by gram-negative bacteria, making it valuable as an option in antibiotic therapy. So let's take a look.
Okay, in this scene we're going to talk about the monobactams, and it's going to be represented by this guy over here who always has money on his back. He has money on his back all the time for monobactams. In fact, his name is...
My name's AZ Tree. AZ Tree's the name.
His name is AZ Tree, and that's going to remind us that the monobactam that we want to be aware of is aztrionem. So this fisherman is holding this fish over here that has an oxygen mask. This fish, which is red and rod-like, is going to remind us of two things. One, that monobactams are effective against gram-negative rods, red for gram-negative since it stains red in gram staining. And the oxygen mask over here is going to help us remember aerobic bacteria. Monobactams are effective against gram-negative rods that are aerobic. They are not effective against gram-positive organisms, and they are not effective against anaerobes. Let's take a look at the other fisherman's hand over here. So here in the bucket of fish, he has this pencil with the tree for penicillin binding protein 3. Monobactams have a special affinity for penicillin binding protein 3, and by doing so they prevent peptidoglycan cross-linking, and this disrupts synthesis of the cell wall. You might have noticed that there was this gliding guy. This guy showed up in our aminoglycoside video. This is the mean guy who glides. Mean guy who glides for aminoglycosides. Monobactams are synergistic with aminoglycosides. This is especially true against organisms such as Pseudomonas aeruginosa. Okay, let's back up here for a second. So here we see this fish over here, the beta fish with the ace on it. Beta fish with an ace. Beta ace for beta-lactam-ace. And he's incapable of doing anything. He's trying to get onto the boat, but it's not working. The boat is resistant. Monobactams differ from other beta-lactam antibiotics by having a standalone beta-lactam ring, which makes them less susceptible to beta-lactamases. Finally, let's look at this part of the scene. Here's this guy trying to get onto the boat, and he's running away from the pencil. He's actually allergic to pencils. This reminds us that monobactams are structurally different enough from penicillins that there is no cross-reactivity to individuals with penicillin allergies, and that's why monobactams are often used in patients who are allergic to penicillins. Okay, in this video we didn't put anything on adverse effects because monobactams usually are non-toxic, but they do cause occasional GI upsetness. Other than that, that's basically it. Okay, I hope you enjoyed this video. Take care.
So really quick, kind of short, breaking it down. The one thing that I do want you guys to know is that these are available for intramuscular or IM or intravenous IV injections. So it makes them suitable for hospital settings, especially in the operating room. Now, They are generally well tolerated, like they said, and have a low risk of cross reactivity in patients. Again, we're giving this when a patient has a penicillin allergy because it is a safer choice for those with a history of allergic reactions to beta-lactam antibiotics. Now, we can utilize it in surgical patients, right? Especially when we know or suspect gram-negative infection, or if we know that they have an allergy to penicillin. It's particularly in cases where other antibiotics are not going to be effective due to resistance. We look at aminoglycosides. These are a class of antibiotics that are effective against a variety of bacterial infections, particularly those caused by gram-negative bacteria. They operate through two primary mechanisms of action which actually go in and disrupt bacterial function and lead to cell death. So what they do is they bind to bacterial ribosomes, especially to disrupt the process of protein synthesis, leading to the production of faulty proteins essential for bacterial growth and function. What happens is now the bacterial is going to be killed rather than just slowing it down. Okay. They also create a small hole or pore in the bacterial cell membrane. And what that does is compromise the membrane's integrity, causing small leakage of essential cellular contents. Now, this mechanism further enhances their bactericidal activity, making them effective even against resistant bacterial strains. For the next couple, I found these and it breaks down what we're talking about. Now, for fluorocanalines, these are a class of antibiotics known for, again, their broad spectrum activity. So we know that this is both gram positive and gram negative. They are particularly effective in treating infections caused by bacteria, again, that are resistant to other antibiotic classes. They have a low toxicity. One of the significant advantages is their relatively low toxicity profile. They are generally well tolerated, making them suitable for a variety of patient populations. They're effective again in both gram positive and gram negative, which does allow them to be used in treating a wide range of infections. But which ones are you wondering? Well, urinary tract infections, respiratory infections, skin infections, and intra-abdominal infections. And so, as you see, it can be given oral or IV, can go into bone, joints, soft tissues. We can use it in the eye. Again, respiratory, GI, and UTIs. You do see the adverse effects though, okay? So tendon ruptures, children less than 18 years old, there could be cartilages, pregnancy category C, you would be hesitant to give. You could potentially get seizures, dizziness, or photosensitivity, of course, when you're injecting something in someone's eye, right? We also have macrolides. Now, these are a class of antibiotics renowned for the effectiveness against a variety of bacterial infections, particularly those caused by gram-positive organisms. They can, do some work on some gram-negative as well. Now, these are only partially metabolized in the body, which means that a significant proportion of the drug remains unchanged and then is going to be excreted through the bile. This characteristic can have implications for patients that have like liver dysfunction, as they are not able to clear these medications and they can be compromised. All right. So you see the route, oral and IV. Now, they are administered usually oral, which makes them convenient for outpatient therapy, right? Like if you're at a surgery center, and they enhance patient compliance. The oral route is especially beneficial for patients who may not require hospitalization for their infection. So they can, take the pill. So some of these you've heard of, erythromycin, clarithromycin, and then you have some more that you can look on table 5.7. Okay, so I highly encourage you guys to look at the tables. This chapter had a lot of tables. All right. Now, again, they work by inhibiting bacterial protein synthesis. This action just makes them effective against the range of pathogens, including those responsible for respiratory infections, skin infections, and some sexually transmitted diseases. And again, I like this because it kind of just shows you where, when we talk about for the upper respiratory tract, sometimes for ears, well, that's otitis. Whenever you see that, that's going to be the ears, ulcers, and of course, skin. So staph. We get into our tetracyclines, the first broad spectrum antibiotic. Now, they represent the first broad spectrum antibiotic. They're effective against a wide range of bacteria, including both gram-positive and gram-negative organisms. They have been fundamental in antibiotic therapy and have paved the way for these newer subclasses, including glycyclines. Now, they are known for their ability to, again, slow down or inhibit a diverse array of bacteria, making them useful to treat things like respiratory tract infections, acne, and certain sexually transmitted infections. Now, it can be administered both orally and intravenously, providing a little bit more flexibility in treatment options. They are primarily excreted in the urine and bile. Refer to table 5.8 for just more information on tetracyclines, including like indications, dosings, and side effects. And our last are our miscellaneous antibiotics. We look at sulfonamides. These are commonly referred as sulfa drugs, were among the first antibiotics discovered and are still used today, often in combination with other antibiotic agents to just enhance their effectiveness. Sulfonamides work by, again, inhibiting bacterial growth through blockage of folic acid synthesis, which is a vital nutrient for bacteria. They compete with PABAs, which are para-aminobenzoic acid, preventing the formation of folate, which is essential for DNA synthesis. What they do is they'll come in and they'll exhibit activity against those wide range of gram-positive and gram-negative bacteria, which actually makes them suitable for treating a lot of different infections. Now, they're often used in combination with other antibiotics just to make them just a little bit stronger and to broaden their spectrum of activity and reduce the likelihood of resistance. So hopefully this video is a little bit better than the last one. The last one's the first time I've used it. I'm probably not going to use it again. But we have the sulfonamide. So let's take a look. And it did not go, so that's okay. With that, what questions do y'all have for me? It looks like we will not have time for our Kahoot, but that's okay because I will send it out to you guys this evening. And you guys can just use that as an additional resource. But what questions do you guys have for me? None, I see head shaking. In that case, we define terms and abbreviations. I know it is a lot of information. We define key terms and abbreviations related to antibiotics and antimicrobial therapy. We discuss antimicrobial agents and their categories and explain healthcare associated and surgical site infections. We cover the purpose of antibiotic therapy in surgery and identify different mechanisms of action for these antimicrobials and explored these crazy antibiotic resistant drugs. The last thing we talked about was categories of antibiotics. Of course, the ones that we use in surgery. Now, for those of you who are watching this playback, we didn't forget about you. What does a CNS revealed, culture and sensitivity? Why is antimicrobial resistance a problem in surgery? And why are antibiotics administered in surgery anyway? Tomorrow is Halloween. You guys be safe. Y'all know people are crazy out there. Thank you all for being here this evening. I love those that were able to turn on your avatars. Thank you for everyone else. I like your crown. Looking pretty awesome, Miss Johnson. I see it. But you guys have a wonderful rest of your evening. Have a great rest of your week. Y'all be safe. I look forward to seeing everyone who is able to attend next week's live session. Happy Halloween and good night, everyone.